This is Ilay Maden, and I wanted to have a few videos to explain what we do at ONCLINIC, our dental practice. Now, our dental practice is majorly focusing on treatments that are digital and laser related. It may not make much sense to many people when you hear about digital and lasers, and that's why we wanted to explain exactly what that is that we're doing. When we say digital, what we mean is taking a lot of manual work and making it more digitally prepared in a computer screen so that everything is designed and kind of produced digitally. So the advantage of going digital is that first of all, it's easier for the patients. It runs smoother. So we don't have any gooey or runny impression materials that go in your mouth with a big tray. We do that all by digital scanners. So we have small cameras which scan the teeth. So we have a copy of your teeth on our screen in our computers where we see everything in detail in magnification. Then if we need to do any changes or do any restorations, we can actually show you before we do anything to the teeth. We can show you how it will be when we are finished with the restoration and the treatment. Now that's one big advantage. The second one would be, in many cases, we can do many stuff in the same day. So if you're coming in for an inlay, like it could be a filling that you came in for, and then we clean the filling, so the caries, and we do that with the laser, which I will talk about in a minute. And then we have a tooth shape. We scan that tooth, we design the restoration, we send the data to a milling machine, which actually produces the restoration immediately, like in 10 to 30 minutes, and then we can just place it in. So that gives us a possibility to finish things in less number of sessions, so you don't need to travel back and forth. And we can provide much better fitting and nicer looking restorations. Now that's one thing. If you think about smile design, so if you're having more number of teeth to be restored for aesthetic reasons, we first check if we can do this minimally invasively. So sometimes just the bleaching or bonding can be done easily and quicker. But if you're looking at veneers, for example, we could, as I said, get the data into a digital form. We get your smiles through photographs and videos, and then we design a new smile. And then you can see how it's going to look like, not only in still photos, but even videos. And then if you like, we go forward with any intervention on the teeth. Sometimes even that is not necessary. We just go on and have the veneers produced, and then actually before having veneers produced, we even have a trial. So we can have other temporary material where we can actually have a trial, so you can go home with your trial smile and ask around to your family and loved ones and get any feedback that you might receive, and then come back to us, and then we do those changes again in the software. Again, we can show you, and then as a last step, we do the restorations at the end. So that means we have a final vision before we start with anything. We start with listening to you, we start with learning what you want and need, what your desires are about your smile, and then we go from there. And as I said before, we start with any intervention, we can have a chat about the results before it has happened. So that's another big advantage. Less time, more predictable results, an opportunity for our patients to see what's going to happen before it does. Now, talking about lasers, lasers are my personal passion. So it's a very important topic in my life because I started very early on in my career to use lasers. And then I studied lasers in Germany. I did my master's on it, and soon after that I started teaching lasers because there were not many people using it at the time. That was in 2007. So why we use lasers is because of the many advantages it has for the patients. It's from disinfection in infectious situations to aesthetics where we want better, fuller lips, smoother skin, and anything in between, from cold sore treatments to snoring treatments. So they don't have anything too similar clinically, obviously, the problems, but because of different modes of operation of the lasers, we could have different effects on the tissues. So if you talk about disinfection. So the infection could be inside a tooth. So that would be like when it needs a root canal treatment. A mechanical treatment has some limitations in how deep it can clean the tooth. With the laser, we can go much deeper. Also, gums can be infected, so that's around the teeth, and that's where we also use the lasers to do the disinfection. In both cases, the amount of depth of disinfection is the main advantage with the laser, and it also provides some energy for healing. So what we call as low-level laser therapy provides energy for actually the cells to heal better and to regenerate more. Then going on from disinfection, we could have like caries removal. So when you need fillings, caries is removed normally by dental burrs, which make probably the ugliest sound, and that's why many people are afraid of dentists. We can replace that machine that makes that horrible sound with lasers, and we can do the fillings with the lasers in most cases without even any pain and any injections. That's another indication where we use the lasers, so filling and replacing classical dental drills. Another disinfection treatment is with cold sores. So with cold sores, we have a virus now, viral infection, and we know it commonly comes back to the surface to create those lesions, and it's highly infectious. So what we do with the laser, again, we can have a deep disinfection, so the viruses don't come to the surface as often as they are used to, and the healing is much shorter. Instead of a week to 10 days, it's 3 to 5 days. And the pain goes away in the same day of the treatment. And then another application area would be facial aesthetics. So that's where we use the laser to stimulate the cells in the skin to produce more collagen. So when there's more collagen, the skin looks healthier, it's younger, and then it's fuller. So that could be advantages in the cheek area, in the nasolabial sulcus area, or the lips themselves. So with the lips, we can have fuller and more defined borders in the lips, and this is called lip lace, and on the skin is called smooth lace. So we have different applications for different areas of the face. These could be done as a standalone treatment if you don't like injections or toxins, but it also can be done in combination with fillers and Botox and other injectables, depending on your choice.